evidence from 6 sub-Saharan African countries.
Thank you to everyone for coming and to the organizers. And I think this builds well off of the previous presentation on the issue of MSM and age and cohort. Okay. So to give an overview, I'll talk a bit about the background of the ethical issues and challenges facing young men who have sex with men, the methods in these studies, and the results will focus on the prevalence of men having anal sex with a man under the age of 18 for the first time, the percentage of participants under the age of 18 in these studies where it was allowed, the HIV prevalence among these participants, and some of the challenges to parental consent, including those who are orphaned, those who haven't disclosed their sexual orientation to their families, and those who have faced stigma from their families. So as has been discussed at other sessions, including the satellite yesterday on adolescent access to prevention and the Adolescent Trials Network Studies 113 and 110, in many settings there are laws, policies, or institutional review board or ethical committee determinations that restrict the access of minors under the age of 18 in HIV prevention or research. Often parental consent is required for their participation. Even though individual and social risks for HIV often occur before age 18, and youth may be unwilling to participate if they have to disclose their behaviors to their parents. This is particularly challenging for adolescent and young key populations, including young MSM, who are at high risk for HIV acquisition. They may have older partners who have higher HIV prevalence, and they're often unwilling or unable to disclose their sexual orientation or practices to their parents. This is especially challenging within sub-Saharan Africa, where HIV prevalence is higher, including among MSM in comparison to other adult men or young men. And often in these settings, sex between men is criminalized and or highly stigmatized. So research on this population is especially relevant, but also tends to be lacking. So this is a secondary analysis of a variety of studies we conducted primarily to assess HIV prevalence among MSM and factors associated with HIV. In Burkina Faso, Lesotho, Malawi, Swaziland, and Togo, we recruited only MSM who were 18 or older into the study through respondent-driven sampling. And in the Gambia, we were able to access MSM 15 years of age and older through snowball sampling. So while we weren't able to often work with young MSM directly, we did ask retrospective questions about the age at which participants first had anal sex with a man in 3 of the countries, and then any type of sex with a man in 3 countries. This question was collected as a continuous variable in 3 of the countries, and then categorically in Malawi, Swaziland, and the Gambia. So unfortunately, the way the categories were collected in those 3 countries, we only know those who had sex with a man under age 16, and then the older group was 16 to 20. So this analysis is just focused on those who first had sex under age 16 for those 3 countries. We dichotomized the variables to show those who had sex under 18 and those whose age of sexual debut was over 18. And we did some tabulations and cross-tabulations to find some results. So data were collected in 2 cities in Burkina Faso, 2 in Togo, 2 in Lesotho, and we had only 1 study site in the remaining countries. You can see here the percentage of study participants who had first had sex with a man when they were under age 18. Across settings combined, it was just over 40% of the MSM participants who first had sex under the age of 18 with a man. The highest percentage was over 60% in Lomé, Togo, and the smallest percentage was under 15% in Swaziland. Among these MSM in these 6 different countries who had sex before the age of 18, the pooled HIV prevalence was just over 15%, which again is often higher than men in the general population in these settings. In the Gambia, MSM under the age of 18, from 15 to 17, were about 12% of the study sample. We pulled some of the results from Burkina Faso, Lesotho, and Togo because those studies had more similar questionnaires and were conducted in similar time periods in 2013 and 2014. And among the MSM who first had sex with a man under age 18, more than 30% reported that one or both parents died before they were 18 years old. So this is an issue we see with many adolescents, particularly in some settings in sub-Saharan Africa, that parental permission is sometimes not possible because they've been orphaned. So this is not unique to MSM. But what is often different among the MSM is that we found that less than 11% had actually disclosed their sexual orientation or behaviors to a parent. So again, this is something that might limit the ability for MSM to participate in research because they're not able to get parental consent because they haven't disclosed their sexual orientation to their parents. Stigma is also another barrier to getting parental consent. So over 1/4 reported that their family members had gossiped about them because they found out that they were MSM, either through their own disclosure or some other way. And more than 10% had been excluded from family gatherings because they're MSM. So again, we see these three issues of those who are orphaned, those who haven't disclosed, and those who have faced stigma from their families that could all present barriers to participation in research with parental consent. So to summarize what we're seeing across these settings, a substantial proportion of MSM participating in the studies had sex with a man under the age of 18. So we are missing this population if we're not including under 18-year-olds in our research. Further research on this group, including waiver of requirements for parental consent, is really needed to find out more of their needs because they do have fairly high HIV prevalence, as we're seeing reported in later cohorts. And then in the Gambia, where we were able to work with those under age 18, we did have a small percentage, but there may be extra efforts needed to recruit those under 18 where this is feasible. So with snowball sampling or respondent-driven sampling, selecting seeds specifically who are under 18 to be able to reach some of their peers. And I want to acknowledge all of the participants in this study, the study staff and investigators, all of our partner organizations in these 6 countries, and the funders from USAID and elsewhere. Take questions.
People would like to come to the mic for questions. One question that I would have is, did you ask anything about how the youth would respond if they were asked to disclose their sexuality to their parents, or if their parents found out? Because there's certainly an issue of potential social harms in a trial would be important to understand.
Right. We didn't ask that, but in many of these studies, we also had qualitative data where the MSM talked about the challenges disclosing to their families and that they were afraid of being kicked out of their homes and having other social consequences. So that's something that in preparation for studies with younger MSM would be very relevant to continue to research.
Thanks very much for your presentation. Hi, I'm just here. I just was wondering if any analysis has been done around the rather large disparity between the percentage of people, men from Southern Africa, where it seems to be much lower, of the countries that were included, if I'm not mistaken, versus those around Burkina Faso and Togo, where the percentage was much higher, and whether their policy or government regulation that might explain what were, to me, look like quite disparate numbers.
Thank you. So in Burkina Faso, MSM are not specifically criminalized, but they're not protected either. So that may be part of what we're seeing. And thank you for the question, because I think it will be interesting to look at the comparison in reported stigma and in policies between these countries. With just 6 countries, we can't really effectively assess whether one particular policy was affecting this or not, but it's something that really requires further study. Thank you.
Hi, I'm just wondering if you, and you may have said it before and I was probably asleep, sorry. Can you tell me whether or not you ask, or how do you define unprotected, I mean having anal sex, the type of anal sex, and also with regards to the age differential between, with whom did these young men have sex? Were they with similar age or were there age differential?
Thank you for these questions. So to participate in the study, these MSM had anal sex, whether it was receptive or inserted, with a man in the past 12 months. In 3 of the countries, in Burkina Faso, Lesotho, and Togo, the question about age of first sex referred specifically to anal sex with a man, whereas in the other 3 countries, the question referred to any type of sex with a man. But again, the anal sex could be insertive or receptive. And sorry, I'm forgetting the last part of your question.
Were they
Are they-
having sex with other guys of their own age, or were they having sex with older guys?
We don't have good or accurate data on that. Sometimes the men said that they didn't know the age of their partner, so it's something that we think requires further refinement in the questions and asking more in future research.
And if folks could identify themselves, please.
Thank you. Sylvia Debajo, Population Council, Nigeria. Thanks for your presentation. I was just wondering if you had ethics approval a priori before the study. And for those who are infected, what did you do with them? What's the age of consent to access care?
So the age of consent to access care varies, and often it's even confusing within a country. So what I was able to find per international guidelines, when I talked to people in Burkina Faso, for example, they said actually they thought it was lower. So it's not always clear the age of consent to participate in research, the age to get a test, the age to get care. So that's something that requires further clarification. And then for the ethical approval, in the studies where Johns Hopkins was the primary recipient of funding, we got Johns Hopkins Bloomberg School of Public Health approval, as well as approval from the national ethics committees or the ethics committees of other organizations involved, such as PSI in Lesotho. And then in the studies, for example, in the Gambia, where Johns Hopkins' role was to provide technical assistance, we primarily got approval from the local ethics committee and then approval for secondary data analysis from the Johns Hopkins IRB.
So this is a very interesting study, or several studies where you use respondent-driven sampling and snowball sampling. I'm just curious, because we're always worried about representativeness of a sample. So did you look at the earlier and later waves in terms of some of these attitudes and beliefs, just to see how robust some of the conclusions might be?
Thank you for this question. So because we were looking at multiple settings and some we had RDS data and some not, we didn't do the adjustments. But in general, we did find that we had difficulty recruiting older participants at MSM 30 or 35 years and older, so that is a limitation. And additionally, we had not looked at differences by wave yet, but I appreciate that suggestion, and we'll take a look at whether we're recruiting those who started at younger ages in earlier or later waves.
Wonderful. Thank you very much.
Thank you.